risk?
So these populations include older people, young children, and people with pre-existing lung or heart conditions. And recent studies also suggest that people with lower socioeconomic status or people who are pregnant and pregnant women and their unborn children are also more susceptible to wildfire smoke exposure. And vulnerability assessment tools have been developed in many regions, including the Lower Mainland. They are essentially maps of vulnerability indexes derived from the spatial distribution of the demographics of the population, the baseline health status such as asthma rates or cardiovascular disease rates among the population, as well as the probability of wildfire smoke exposure in that region. So the most commonly used data for tracking smoke exposure health impacts is asthma-related data. For example, we have physician visits for asthma, or the dispensations of medication for asthma reliefs. And these data has been found to be very consistently associated with elevated wildfire smoke exposure, both in epidemiology studies and in our surveillance system. So far, most evidence has suggested short-term health effects after exposure to wildfire smoke. So exposure measured by days or hours. So we tracking these data near real time can help us to monitor such as short-term health effects among the population, and also it can inform very timely public health actions. On the other hand, there has been very little evidence available for us to know what's the long-term health effects of wildfire smoke exposure. So the first step to study that will be to track these data for the long term so that we can study the health effects. We can use historical data to study the relationship between wildfire smoke exposure and the health effect, and then use that relationship to build a model that can predict future health impacts using smoke forecasts. And having those health impact forecasts, we can provide an early warning to communities that are more likely to be exposed to wildfire smoke and more likely to have those health impacts, so that they can be well prepared before the wildfire smoke event actually happens. To monitor the health impact of wildfire smoke exposure, there can be many different data sources that we need to access, manage, or evaluate. So it will be very important for us to have one system that can easily integrate and visualize all these data. And even better, if we can have a tool that can be interactive rather than static, so that the users can adjust the tool according to their needs. So that will be ideal for public health professionals to have such a system.